add some vitamins like vitamin B1, B2, B3, coenzyme A. All of them, they are consist of nucleotides. So nucleotides are important as a coenzyme. In addition to coenzyme, we need energy as a form of ATP. So ATP also is a nucleotide. In addition to this, also we need nucleotide for synthesis of protein, for synthesis of sugar like glycogen, UDP glucose. For metabolism of compound like bilirubin, UDP glucose is added. UDP is a nucleotide. So we need nucleotide for many pathways. But related to their metabolism, we can divide them to catabolism and synthesis. Synthesis itself can be occurs in two ways, de novo or salvage. So I'm start with the catabolism of purine and then one by one as Allah said. We have some disease related to nucleotide metabolism like both Lesch-Nyhan syndrome, adenosine deaminase deficiency, and purine nucleoside phosphorylase deficiency. They are related to purine metabolism. And related to pyrimidine metabolism, uric aciduria is one of the main diseases. Here you can see when we eat food, it contains nucleoprotein. Nucleoprotein, actually protein, consists of protein and RNA and DNA or nucleic acid. In the stomach, gastric acid and pepsin release protein and we produce nucleic acid, RNA and DNA. So then we cut this nucleotide, this polymer, to the nucleotides by phosphodiesterase. So NTP, as Allah mentioned, consists of three parts: phosphate, sugar, and nitrogen space. First of all, we remove phosphate by nucleotidase. Nucleotidase remove phosphate. So what remains for us? Nucleoside. Nucleoside consists of what? Sugar and nitrogen space. So the sugar is removed by nucleosidase and base is remained. It should be purine or pyrimidine. So we are going to talk about catabolism of purine and pyrimidine one by one. You remember the structure of the main purine, guanine and adenine. But during the catabolism of purine, we have three other nucleotides: hypoxanthine, xanthine, and uric acid. The structure are somehow similar. If you look at the adenine has an amino group, guanine has an oxy and amino group. But hypoxanthine, instead of amino, just has an oxy, xanthine has a 2-oxy, and uric acid has a 3-oxy. Why we add this oxy? Because these compounds, they are not water soluble. If we are going to excrete them, we have to add some molecule to become more water soluble, and then we can excrete. It's so interesting, you know, thein in the tea, caffeine in the coffee, and theobromine in the chocolate. Their structure is exactly like uric acid, but they have a methyl group. If we have a 1 methyl group here, is thein. If we have a 2 methyl group, is caffeine. If we have a 3 methyl group, is theobromine. So they are also a nucleotide sample. So they are the structure of the main nucleotide, and also we can change some, actually a small part of nucleotide. When we change the structure, we can use them as an anti-cancer or antibiotic drug. Why? Because we need nucleotide for DNA synthesis. When we don't have nucleotide, we can't make a new copy of DNA. When we don't have a new copy of DNA, we can't make a new cells. In eukaryotic, tumor cell cannot proliferate. In prokaryotic, the bacterial cell cannot proliferate. So they can be used as an antibiotic or anti-cancer drug. So Here is the purine breakdown. If you look at that, the final product is uric acid, but daily production is how much? 600 milligram per deciliter per liter. The solubility is 70. So less than 10%, actually about 10% of uric acid is water soluble, and 90% is water insoluble. So we have a big problem to excrete this uric acid. What's happened? If you look at that, we have a ATP, ADP, AMP, doesn't matter. If we remove phosphate group, finally we have a AMP. Then this AMP can go through two pathways. One of them, the first we can remove what? Phosphate, and it's produced adenosine. When we remove phosphate, by which enzyme? Nucleotidase. Nucleotidase remove phosphate, AMP convert to the adenosine. Or then adenosine remove amino group, by which enzyme? Adenosine deaminase. Remember this enzyme is so important, I will ask you in the next step. Adenosine deaminase convert adenosine to inosine. Or in the other way, we remove the amine first by adenosine deaminase, and then we remove phosphate by nucleotidase. Again, we produce inosine. But here we have actually molecule which is known as an inosine monophosphate or inosine. Inosine also is a nucleoside. The base of inosine is hypoxanthine. The nitrogenous base of inosine is hypoxanthine. If we remove the sugar, hypoxanthine is weak. It was questioned for many times in basic science. What is the name of the base of inosine? Hypoxanthine. Hypoxanthine is the base of inosine. So the next, what's happened? Xanthine by the enzyme, which name is xanthine oxidase. Here, convert to the xanthine. Then again, we have a xanthine oxidase convert to the uric acid. Yesterday I told you we have a xanthine oxidase. Yes. It's belong to the oxidase group, and it was produced. What produced for us by xanthine oxidase? H2O2. So H2O2 also is produced here. So if you look at that, we have a purine nucleotide, for example AMP. We can remove phosphate, then sugar, then amine group, and then sugar. Or we can remove amine, phosphate, and then sugar. Finally, we will have a hypoxanthine, and then xanthine uric acid. Again, if you look at that, for guanine, it's somehow similar. First of all, we remove phosphate, then we have a guanosine. Guanosine remove ribose, produce guanine, and guanine by guanase convert to the xanthine. And xanthine by xanthine oxidase convert to the uric acid. If we look at both of them together, you can see adenosine monophosphate or guanosine monophosphate, finally both of them convert to the uric acid. If we have an accumulation in uric acid, the disease is known as a gout. So which enzyme produce uric acid for us? Xanthine oxidase. So if we are going to treat gout, what should we do? Inhibit xanthine oxidase. What drug inhibits xanthine oxidase? Allopurinol. Allopurinol is a drug for those people with gout. If you use this drug, for this xanthine oxidase is inhibited and uric acid production is decreased.
Which people don't do?
Goat, necklace. Necklace. So we have a catalase to degrade H2O2 to water also, in addition to other enzymes. So it was catabolism of purine. Related to catabolism of pyrimidine, Allah. Where are you, Allah? You're thinking it was. Related to pyrimidine degradation because they produce this molecule, beta-alanine. Beta-amino is a butyric acid, and most of them, they are water soluble. We don't have any problem. And we don't say a lot about the catabolism of pyrimidine. Just, you should know, cytosine and uracil convert to the beta-alanine, and thymine, because it has another methyl group, convert to the beta-amino isobutyric acid, isn't it? For catabolism of pyrimidine. Then we are going to talk about the de novo synthesis. For de novo synthesis, and actually for salvage, you didn't say them actually the differences of salvage and de novo. Salvage means recycling, garbage recycling, you know. It means you have something that is not similar to the use like the first time. But if you salvage it and change it to its material, you can use it again, but not completely. For example, you have a plastic or marker. When you salvage it, you don't have a marker again, but you have some material which you can use them to produce or to make a marker again. The salvage is like that. So we have a salvage and de novo synthesis. But first of all, for de novo synthesis, we need a backbone. For example, when we are going to make a building, make an apartment, we need a basement. Without basement, you can't make an apartment. So what is the basement for nucleotide? Sugar. Foundation is sugar. So sugar itself cannot be used as a foundation. Sugar needs to be activated. So the sugar in the nucleotide is a ribose, actually, yeah? Ribose or deoxyribose. So ribose is produced as a form of ribose phosphate from pentose phosphate pathway. One of the main production of pentose phosphate is ribose phosphate for nucleotide, and the second is the second production of the pentose phosphate pathway. I'm so happy you don't answer this question, and I will see you next semester because I love you too much and
She just said that, like,
yes, she just said that, but you don't remember that.
It's not you.
NADPH, don't kill yourself. NADPH, okay? NADPH and pentose phosphate. Well, you look at Jaffa. It's not actually, nobody guaranteed Jaffa just answer my question. You know, all of you should answer. Ribose phosphate. Ribose phosphate, or other way we call it phosphoriboside. Phosphoriboside or ribose phosphate, both are similar. So if we take another phosphate from ATP, so these two phosphate together, what we call it? Two phosphate together. Pyrophosphate. Pyrophosphate. So we add a pyrophosphate to phosphoriboside. What is produced for us?
Pyrophosphate, phosphoribose pyrophosphate.
PRP.
Phosphoriboside pyrophosphate, PRP. Or if you look at the structure, it's like that. We have a phosphate here, and we have a 2-phosphate here. Phosphoriboside pyrophosphate, or PRP. So this enzyme is going to synthesize this molecule. So the name is phosphoriboside pyrophosphate synthase. This enzyme is so important in producing both purine and pyrimidine, and is one of the main site of regulation of synthesis of purine and pyrimidine. If you look at here, this is ribose phosphate or phosphoribose, receive 2 phosphate from ATP, convert to the phosphoribosic pyrophosphate. The enzyme is PRPP synthetase. So some molecule like GDP and ADP, they are the end product of the pathway. They are going to synthesis nucleotide. When we produce enough ADP and GDP, they come and inhibit PRPP synthetase and say we don't need it too much. And phosphate, inorganic phosphate, PO4, is activator. So remember this, activator and inhibitor. So related to purine, the structure, if you remember, we had a 6 ring and we had a 5 ring. Okay? We have the 2 nitrogen here, and these 2 cells. Okay, is a structure, is a backbone of pyrimidine. Pyrimidine or purine?
Purine.
Pyrimidine, no, purine.
Purine.
But it's a dual structure.
This nitrogen, the first nitrogen, produced from glutamine. The enzyme name is glutamine phosphoriboside pyrophosphate aminotransferase. It means from the glutamine, amido group is transferred to the PRP. When we add the amido group, pyrophosphate is released, glutamate also is released, just amido group is added to the sugar. Imagine we have here sugar, phosphate, here we have the 2 pyrophosphate. We remove these 2 pyrophosphate and bind this nitrogen group to the sugar. And is the commitment a step in the purine synthesis. ILP, GMP, and ALP are inhibitor, and PRPP itself is inducer, activator. So after that, we added this part. This part is a glycine. So we will add 1 glycine to the structure. Then we have 1 carbon here. This carbon is provided by what?
Tetrahydroflame.
Tetrahydrofolic acid or folic acid. Then we have this nitrogen. This nitrogen again provided by what?
Glutamate.
Glutamine. So what remains for us? This carbon, and this nitrogen. This carbon is provided again by tetrahydrofolic acid. This carbon is provided by CO2 or bicarbonate. What's remain for us?
Nitrogen.
1 nitrogen here. This nitrogen is provided by aspartate. So, which one of the following amino acid does not used for purine synthesis? Glutamine, glutamate, glycine, aspartate. Exactly, aspartate. No. What is that? No. Glutamate. Yeah. All of the following we need for synthesis of the purine: glycine, PRPP, folic acid,
Glycine.
carbamyl phosphate.
Carbonate phosphate.
Folic acid.
Which one?
Folic acid is used.
No.
So we need glutamine. We need
We need glutamate.
glutamine.
Glutamine.
Yes.
Don't need glycine. We don't need glycine. What is that?
Glycine, glutamine is
So glycine just attaches to these two. Yes.
Whole glycine, the whole molecule of glycine bind here. This carbon, and this nitrogen.
Just binding.
Yes.
amino acid. What were the options?
So the nitrogen number 1 in the structure is produced from what?
Right?
Yes.
Could you-
The nitrogen number 7.
Also glutamine. Aspartame.
Glycine. There are some example of my question. So here ribose phosphate by PRPP synthetase convert to the PRPP, and actually we have some activator which known as a inorganic anhydrase. This actually figure show you the whole structure. These two nitrogen provided by glutamine, these two carbon provided by tetrahydrofolate, these 3 atom, carbon, and nitrogen from glycine, this carbon from CO2, and aspartate. They are the whole structure. But we need near to 13 steps to produce a 1 nucleotide. But you don't need to know all the mechanism. Just the first 2 steps, which PRPP synthetase and PRP glutamine amidotransferase, which they were commitment step, are important. Then we will add glycine, glutamate, aspartate, tetrahydrofolic acid one by one. Finally, we will have an inosine monophosphate. Inosine monophosphate has a 2 phase or 2 pathway. From the one side, first of all, from this side, by IMP dehydrogenase, convert to the xanthosine monophosphate, then by adding ATP and receiving nitrogen from glutamine, convert to the GMP. Then GMP convert to the GPP and GTP. Okay? From this side, receive amine group from aspartate, produce fumarate, and finally convert to the AMP and then ATP. In the nature, in our body, we have a balance. What is the meaning of balance? If you look at that, we have a 2 sides. This side, for actually happening on this side, we need what?
ATP.
ATP. ATP is produced by
Adenosine
This side.
monophosphate. AMP.
the product of this side is ATP. And this way, for actually occurring of this way, we need what?
GTP.
GTP is produced.
GM.
So we have a balance. If we produce GTP enough, we can produce
Just
ATP,
ATP.
and vice versa. But if we don't have ATP enough, we don't have GTP enough also. And all the time balance is actually happening between these 2 pathways. But as actually Ala mentioned, here we have some PABA analog, which the PABA is somehow similar to folic acid. In bacteria, we have some classes of antibiotic which known as a sulfonamide. Sulfonamides, they are similar to the PABA. PABA is important for folic acid. When we use sulfonamide, instead of folic acid, sulfonamide does not allow to folic acid created. When we don't have folic acid, we can't make a nucleotide. When we don't have nucleotide, we can make a DNA. When we don't have DNA, we can't proliferate cells. So sulfonamides are antibiotics. But in eukaryotic cells, we receive folic acid from diet and then we activate it. eat. Here we have a drug which is known as a methotrexate, which is one of the
For
most
cancer.
well-known anti-cancer drugs. Methotrexate does not allow to tetrahydrofolic acid
To work
to
on
reactivate. So when we don't have a tetrahydrofolic acid activated, we can't make a
DNA.
purine and pyrimidine and
Which
DNA.
makes DNA.
Then we can't do proliferation. Like and again, we have another drug which is known as a mycophenolic acid. Mycophenolic acid is an inhibitor of IMP dehydrogenase. Why it's do? For those people actually receive transplantation, for example, kidney transplantation. We use what kind of drug? Immunosuppressive drug. What they do, immunosuppressive drug? Suppress the immune cell proliferation.
So it does not.
Immune cell proliferation. How they do their work? By actually inhibiting these enzymes. They don't allow GTP is produced. Then we don't have ATP, we don't have nucleotide, we don't have DNA in these cells. Does they have a side effect?
Yeah.
Might be.
Yeah, exactly. All of the anti-cancer chemotherapy agent or this immunosuppressive drug, they have a
Side effects.
side effect. In which organ? In which tissue?
The
Liver?
Those tissue, they have a high rate of cell replication, like our skin, hair, GI, immune cells. So one of the side effects of chemotherapy is they lose their
Skin?
hair. The skin actually is colorless somehow. And they have a problem in their GI tract all the time. And their immune system is so weak. Is actually complication of using transplant drug. You know what is the problem of transplantation patient? What I'm talking about what? You understand what I'm saying right now? No? At all? Why you are here? What are you doing? If you don't understand, just you have to try, you have to listen, you have to ask. If you don't like to participate in the class, I don't push you, I don't actually press you to actually sit here. You know, if you enjoy being outside, going to the beach and actually seeing the sea, I prefer you go outside. I don't want to bother you to actually push you to stay here and listen to these actually misinformation. So, is the whole pathway of synthesis of purine again, and then when we make it AMP, we use ATP to convert it to ADP, then to the ATP. We use ATP to convert all monophosphate to diphosphate and diphosphate to the triphosphate. If you look at that, when we use some drug or inhibitor of purine synthesis, we have a complication in fetus, in bone marrow, in the skin, GI tract, immune system, and hair follicle. And the complication including anemia, scaly skin, GI tract disturbance, immunodeficiency, and hair loss. So related to pyrimidine de novo synthesis, if you look at the whole pathway, as you didn't learn in the urea cycle, the first enzyme was carbamide phosphate synthase. But carbamide phosphate synthase type 1 was important in the urea cycle. It was located in the mitochondria. Here carbamide phosphate synthase type 2 we have and is located in the cytosol. So carbamide phosphate is produced from glutamine and CO2 and ATP. For pyrimidine, we need carbamide phosphate. First of all, we have a CO2 and we have a glutamine, and by using ATP, to produce carbamide phosphate. Then carbamide phosphate, by receiving the aspartate together by carbamide phosphate, aspartate transcarbamylase. Okay, aspartate transcarbamylase or carboxyl aspartic acid transferase produce uric acid for us. And uric acid convert to the UMP. UMP is the first pyrimidine which is synthesized. Then we convert it to the different pyrimidine, like thymine or cytosine. For thymine, we convert it to the deoxy-4, DUDP, and then convert to the thymine because we need thymine just for DNA. So we need a deoxy-4. And by using CTP synthetase, we convert it to the CTP.
So we should having the UMP first to have
Yes.
time.
Exactly. From the UMP, we can synthesize TMP or CMP or CTP. So they are related to regulation.
So TMP is for DNA.
DTMP. We have enzyme ribonucleotide reductase which reduce all NDP to the DNDP. And we have a thymidylate synthase which 5-fluorouracil, as you actually all said, is inhibitor. And we have a dihydrofolate reductase or DHFR which inhibited by methotrexate or pyrimethamine or trimethoprim. This enzyme, ribonucleotide reductase, reduced ribose form of nucleotide to deoxyribose. So we need deoxyribose for DNA. Ribose for So hydroxyurea and DADP and DATP are inhibitor. Remember that DADP and DATP are inhibitor of ribonucleotide reductase. If we have increasing in these two molecules, what's happened? So they inhibit this enzyme. When they inhibit this enzyme, we don't have.
And we don't have DT.
When we don't have this,
We don't have
we
DNA.
don't have DNA. When we don't have DNA, what's happened? Especially for those cells which they have a high turnover, like immune cells.
Immune cells.
So we have one disease which known as a severe combined immunodeficiency disease. SCI, severe combined immunodeficiency disease, is due to the dysfunction of adenosine deaminase. What was the function of adenosine deaminase?
It removes the amino group.
Adenosine, degrade adenosine to the actually inosine and hypoglycemic. When this enzyme has a dysfunction, DADP and actually DATP are increased. When they are increased, this enzyme is inhibited. When this enzyme is inhibited, immunodeficiency is up. So related to salvage, in the salvage, we actually have a PRPP and then just we add a base. We remove the base and add it to the PRPP and produce nucleotide. We have two main enzymes. One of them is APRT, adenosine phosphoribosyltransferase transferase, which convert adenine to the AMP. But the main enzyme in the salvage is a HGPRT, hypoxanthine guanine phosphoribosyltransferase transferase, HGPRT.
So do we have to memorize everything?
Yes.
All the pathways?
All the pathways. Yes. Guanine and hypoxanthine together by this enzyme convert to the IMP and GMP. You know why I said? Because he was asleep during these 20 minutes that passed, and he wake up. Do we need to actually? I said yes.
No, it's more than 20 pathways.
So hyperxanthine and guanine together convert to the IMP antigen. If we have a dysfunction in this enzyme, it leads to the syndrome which is known as a Lesch-Nyhan syndrome. They are the name of two scientists which they discovered this disease, Lesch-Nyhan syndrome. So let's go to the Lesch-Nyhan syndrome. What is that? And actually,
Can you take 5 minutes rest? At least let's
no,
break
I
up.
wanted to finish actually to finish. Dominance deficiency, as I mentioned, lead to the SCID because the B cell and T cell function cannot occur very well because of accumulation of DATP. Ribonucleotide reductase is inhibited, and then the immune cells are actually affected. So, they actually, this pathway is for the salvage. If you look at that, when we have hyperxanthine and guanine, 90% of these bases are salvaged by this enzyme. 90%. And just 10% go to the
Uric cycle.
uric acid. So, if we have a dysfunction in this enzyme, actually uric acid is decreased. But if we have a xanthine oxidase, uric acid is increased, allopurinol is inhibited. But what do you think about if we have a dysfunction in this enzyme? What's happened?
We have too much uric acid.
Uric acid is
Too much.
increased. So the gout also is one of the complication of Lesch-Nyhan, and also severe gout, because all of these they are going to the uric acid. So what's happened for this kind of actually disease? By Mikhail Lesch and William Nyhan in 1964 they discovered. It's due to the dysfunction of HPRT and only in males because it's X-linked. Because it's X-linked, just it's seen in males. So we have an elevation in actually PRPT, and if you look at that, they are the patient with Lesch-Nyhan syndrome. They actually, one of the complications is to self-motivate. They beat their lip and their finger. Why they actually beat themselves?
Is something the issue with their central nervous system?
No.
They feel pain, maybe. They feel pain. Maybe.
They feel pain, yeah, really.
So that's,
What is the source of this pain? The accumulation of uric acid. Uric acid is accumulated in the soft tissue, and the structure is like that. It's like a needle. Produce a needle, especially in the lip, in the finger, in the soft tissue, and lead to a lot of pain. And they will just want to beat it to actually release the pain. And also in the joint, they accumulated. Here, in the finger, this finger, feet finger, also in this area of the ear, uric acid is accumulated. I will bring the photo for you. You can look at that. This finger actually swell too much. This finger also, and also in the joint. Uric acid is accumulated. There are some people with gout, especially in the ear and the finger. So, causes of the gout, one of them is due to the kidney disease. Kidney cannot excrete uric acid enough, so uric acid accumulated. The second is cancer chemotherapy. Cancer chemotherapy, they degrade cells, degrade DNA, DNA degrade to base purine and pyrimidine, purine degraded to uric acid is increased. So elevated PRPP synthetase. Because PRPP was inducer for purine production, also we have increasing in production, increasing in catabolism. Deficiency of salvage pathway, HGPRP. Also because we have a deficiency of salvage, they are going to the uric acid production. So the concentration, the normal concentration of uric acid is between 3 to 7 to 8 milligram per deciliter, and a higher amount lead to the uricemia. Uricemia or uric acid increase in the blood. Some the allopurine structure, if you look at that, is similar to the hypoxanthine, but just by replacing these two atoms, nitrogen and carbon together, they create this molecule. If xanthine oxidase bind to this molecule, is inhibitor. Is a competitive inhibitor.
Question. Can this disease be treated with dialysis of the blood dialysis?
Not completely dialysis, but somehow can release some part of uric acid. Not completely. Hypouricemia, it was hyperuricemia, and hypouricemia can be due to the severe liver disease. When we have a severe liver disease, we can't produce enough nucleotide and we can't catabolize them. So uric acid decrease. Defective of renal tubular reabsorption, Fanconi syndrome. We have a defective in the tubular, so we can't reabsorb uric acid. Uric acid excreted in the urine. Chemotherapy with 6-mercaptopurine is actually exceptional. And then our treatment with allopurinol. If you use allopurinol overdose, actually high dose, also decrease uric acid too much and lead to the hypouricemia. Is actually the table of disorder related to purine metabolism, GOAT, Leishman, SCID, immunodeficiency, and Fungerka. Fungerka, as Allah said, I again ask you, why Fungerka, which is related to glucose 6-phosphatase deficiency, lead to the
It's related to the winter sugar.
no.
So it leads to what?
You know, when we have a dysfunction of glucose 6-phosphatase,
Leads to hyperuricemia.
lead to hyperuricemia. Why?
Because we don't have a pentose sugar, and that's we don't make.
We don't make what?
Because the
Allah, can you give me the answer?
They have after all, I stood there and explained it. I have to be upset, Aslan. I won't-
Okay, say why when we have a glucose 6-phosphatase deficiency, we have a hyperuricemia. What is the reason?
Because it stops the phosphate pathway. So we don't have the ribose.
No. When we have a dysfunction, somehow yes, but in vice versa. When we have a glucose 6-phosphate dysfunction, glucose 6-phosphate cannot go through this pathway. So he has to select another pathway. Which pathway? Pentose phosphate pathway. During pentose phosphate pathway, what is produced finally? Ribose. Then ribose phosphate convert to the PRPP. And PRPP is inducer of purine synthesis. Then we have a lot of purine and we should have a lot of uric acid. Is the reason. Because cannot go through this pathway, Go through the NPN. So you have another question from the guys from the student?
Yeah, I do have.
Okay, ask your question.
Doctor, could you repeat this?
No. So ask your question.
So this is the point that I didn't really, it was more like about the pentose 5 phosphate. Like I knew it interfered with the pentose 5 pathway, but I didn't know that in fact.
Ask your question. Pay attention to the other.
Where?
You were back? There. They stole it. Is actually treasure.
Yeah.
I gave them to the student.
Why?
Because
They
they
didn't
were
answer.
Fatima actually stayed my I was sitting there and Fatima actually looked at me in my chair.
Okay, that is something I want to say, okay? I had a teacher who used to say that the people who can ask questions, like about what they understood, you know what I'm saying, they can form questions, are people who actually understood what they learned. You know what I'm saying?
Yes.
Like you don't tell me that this happens, but you ask questions that their answer has to be to what you understood. Well, you know what I'm saying? So now I'm gonna ask some questions, but I want some of you to try to ask questions themselves. You know what I'm saying? Like you understood something about how like what amino acids or whatever make the nucleotide base of purine and pyrimidine, right? So for example, ask questions about this one, and then tell me the question or ask your classmates, okay? When I'm done.
So I guarantee they can't ask question because they didn't
They didn't
understand.
That's what I'm saying. If you understood, ask you. I'm gonna ask mine, okay? If someone was able to form a question, then they can ask. Okay. Okay, since you were talking about diseases and so on. So, in what disease does HGPRT affected?
Leishman syndrome.
That's
So
true.
Barber and Feld is both actually at the same time they
Yeah.
did that.
Well,
Barber, Norman Barber and Baptist.
Just throw it.
You can give one and they can give one.
I don't want to split it.
Because at the same time they answer.
I worked hard on this now.
Help him.
Yeah, we
no,
both
don't
did
give it to
actually.
him. No, he has to answer.
Okay.
Okay. So, what enzyme is inhibited by folic acid analogs?
Folic acid?
What
Analog.
enzyme is inhibited by folic acid analogs?
Folic
Just
acid.
give them 30 seconds because they Google it.
Okay, first of all, what are
Timer delayed?
acid? What are folic acid analogs? Yeah, so whoever holds this phone is not gonna answer, right?
Sorry, again.
Olivia?
Again.
Okay. So what enzyme is inhibited by folic acid? Okay, we're gonna explain it then. No one's taking chocolate for this one. Folic acid analogs are MTX and AP. You know the ones the professor also explained.
Aminopentine and methotrexate.
Methotrexate, the ones we're
This is for,
used for cancer.
DHF.
DHF.
Dihydrofolate reductase.
Yes.
Exactly. That's
You're saying analogs.
Doesn't matter.
She-
They are
These are folic acid analogs.
I don't know what analogs means.
Okay, so can I see my slides?
Yes, no.
Because I wrote them like
Show
that.
them.
I know.
Folic acid analogs, MTX, AP.
You know, Mr. Jafar Khan. Look at here, he's a folic acid. Okay? Let's move to actually.
These are folic acid analogs. MTX.
I
He's
don't
a
know.
folic acid structure.
this first.
Is an AP or aminopentine.
Yeah, for
Look at the
abortion.
structure, completely
Abortion.
similar. Is a methotrexate.
For cancer.
Yes.
Anti-cancer.
Not, it's actually is an
Antibiotic.
antibacterial. Methotrexate
Second
is
for
for cancer.
abortion.
Doesn't matter. They both are analog of folic acid.
as you mentioned.
Okay, because you got the enzyme, right? So I'll give you one. It's fine.
I got
You got the enzyme. Okay, so
You have to pay the price.
She said analog. She didn't say.
No,
Yeah,
you have to pay the price after receiving.
What?
The price of these.
Oh, yeah.
Return it back.
okay. What is the rate limiting step in pyrimidine? What is it? In pyrimidine degradation. Rate limiting step.
Dihydropyrimidine dehydrogenase.
Yeah, that's
Yeah.
true. Good notes, by the way. Okay, good notes.
Because you speak slow, I
Give
can write.
it one, don't give it two.
It's fine. Two for
One is enough for Jack.
Yes, thank you.
fine.
Do not give it to
I'm
us.
not giving him anything.
And I propose him to separate his room from you.
So I have one more question. Anyone tried to ask questions, to make questions?
No.
No one tried, huh?
They are just actually look at their watch to finish the time and go to the bed. You know?
I can see. So the last question, and this one is easy, okay? So why do we need salvage pathway?
We need the salvage pathway because we do not
Recycle.
always have the phosphate. Also because to save energy. No, it says so in your slides though.
Why do we need salvage pathway, not de novo?
But
And then even in de novo, it's not ribose 5-phosphate that I thought.
In the prof slide it says to save fuel.
Yeah, because it doesn't use ATP.
Why do we need salvage
Because not
pathway?
every tissue can not every tissue can make things from scratch.
But why? I talked about it.
For recycling.
On the side.
So that's
For recycling.
that is as nucleotides.
What is it?
Because not all tissues can build everything from scratch. That's why you need
Not
salvage.
all tissues, some tissues need salvage pathway to make nucleotides. Okay, that's
Brain. I said it. I said it.
Wait. What did you say?
Lie on lie.
Not all tissues can? Okay.
Sir, it says in your slides to save fuel though, doesn't it?
Yeah, but he's also said recycle.
No.
But she actually her meaning about the brain. Brain cannot use the nervous system and completely dependent on the salvage method.
I find it hard to know.
I'll give everyone. That's fine. But now I'm done with my question.
Why did you give it to everyone?
It's in front of you. It's in front of you.
Yeah, but I talked about something. I put it like aside.
I did.
Brains.
You give him 2 for his distance.
Aside. Okay, so I'm done. No one has any questions, right?
I have a question which is unrelated to the actual topic though. Why did you decide to do this seriously?
To do what?
This presentation? Because it clearly took you a lot of time to prepare for.
It did. But you know, there's something.
I will make a presentation to.
No, I was just kidding. Grace, no, I was just kidding. Of course, I was just kidding.
I remember from the last one.
Now, let me tell you something. There is something called Feynman technique. Have you ever heard about
Yes.
it?
So that is to teach something.
Teach something to learn it.
Explain something, he understands it himself more.
Yes.
I'm not using it. I know, like, I'm always like, sit and let me explain to you, to all of my friends. So that's why I was like, I find biochemistry actually hard. You know, I'm sorry. I don't like it.
So you try to
And let me tell you something, amino acid, lipid metabolism, and glucose and carbohydrate metabolism are much more interesting than this. So I was like, let me choose something hard for me and try to